becoming blind. So today is World Prematurity Day, November 17th, and we are all gathered here for a cause because I have been working in the field of retinopathy of prematurity for the last 10 years, and right in front of my eyes, I have seen babies becoming blind. Okay, in the next few slides, you would know what is the reason why they become blind. It's an unnecessary blindness. They shouldn't have become blind at all. So I'm sure with all your effort and together we can just make sure that we give a very good future to our little ones. So basically, a World Prematurity Day is kind of observed to create awareness on various conditions and issues with these little ones. And one such topic which is very, very close to my heart is retinopathy of prematurity. So each one of you out there, all of you there, you're here because you have a very, very important role in saving the little ones from blindness due to retinopathy of prematurity. We are here because we want to light their life. We don't want them to become blind. They become blind. They're not born blind. They become blind, and it can be easily prevented. It's like how we have awareness for wear helmet while you're driving so that you don't have head injury, and all of us wear. Cigarette smoking is injurious to health. We are aware, so we don't smoke. So similarly, if we create awareness, if people know about this condition, I'm sure none of the children here are going to be blind. So I really want to thank all of you again for you're here because you want to eliminate blindness due to retinopathy of prematurity, and we want to thank from the Yenepoya University for being here. It's not only by the people who are employed in Yenepoya University, it's the little ones in the NICU, they do not have any, they cannot express their feeling. Only thing they know to do is cry. They cry when they're hungry, they cry when they're happy, they cry when they are angry, they cry when they have pain. That's the only way that they can express. So it's very difficult to know what the little one is going through. So it's our responsibility. It's my responsibility. It's your responsibility. It's a responsibility of the entire society to give them a wonderful life. So that's why we are all here. We have to just make sure that none of them become blind unnecessarily. So I'm sure there are medical students as well as non-medical students also. So for the benefit of non-medical students, now who are premature babies? And premature makkalendre yaru? Premature makkalendre babies who are born too soon. And 9 tingalalli is 9 months is when the delivery happens. The full-term child is about 9 months of it. At 9 months, the baby delivers. Now, when the baby is born early, okay, so that's when they are called as premature babies. And these premature babies are the babies who are at risk for retinopathy of prematurity. Just remember this word. And actually this disorder, retinal disorder, not many people are aware of. Most of them are not aware of, and it's the incidence is very, very less, but it doesn't mean to say that a child should go blind because there's no awareness and because of ignorance the baby has become blind. So we should know about retinopathy of prematurity. We have to tell our society, our relatives, our friends about this condition. So we know premature babies are babies who are born too soon. Okay, so now the problem with this condition, that with this retinopathy of prematurity, is that it is a condition which can cause blindness. It's not that all babies are going to be blind due to retinopathy of prematurity, but the babies who develop retinopathy of prematurity, few of them can become blind if the treatment is not given. So it's basically a disease which is seen inside the eye. So that is, if I have to show the pointer. Yeah, So basically, it's a disease which is seen in the retina. Now, retina means it's a film which is inside the eye, and it is seen in premature babies. So for the non-medical students, so premature babies are babies who are born too soon, and these babies develop some disease in the retina, some condition in the retina, which is this retina is a film inside the eye, and this is seen in premature babies born before 8 months. So normal birth is at 9 months. So it's very, very unfortunate to know. It's extremely unfortunate that in India, every year, 3,000 premature babies are becoming blind. Now, I belong to a place called as Mangalore. And in my last few years, I have seen at least about 5 to 6 children have just become blind for no reason. It has happened because though there is good facility, though it's not an expensive treatment at all, and though we have a lot of health facilities excellent here, now in spite of this, babies have become blind. So it's very unfortunate to know that in India, every year 3,000 premature babies become blind, not because there is no facility, not because there is no treatment, not because the treatment is expensive. It's only because of ignorance, and because of ignorance there is a delay in treatment. I'll tell you why. Okay, so basically it's because of ignorance. So we are all here to treat ignorance. Forget about treating retinopathy of prematurity. Now, treating ignorance. So we have to find a medicine to treat ignorance. Now, what is a medicine to treat ignorance? The medicine to treat ignorance is to create awareness. Now, who has to create awareness? It is us. So being in medical profession, it is our responsibility to our society to create awareness. And you being, NSS service members and others in the society, it's your responsibility to make sure that you spread awareness. We talk about movies, we talk about so many things, but when it comes to awareness and health related issues, we do not want to share. So, but that's not it. I mean, it's very, very important that we create awareness and share what we have learned, like how Dr. Gananatha sir rightly said that, when you have to know about the condition, only if you know about it, you're aware about it, you can prevent the disease from happening. As I told you, it is basically because of lack of awareness and ignorance. Now, lack of awareness and ignorance is in our hands, and it's one which can be easily created, in the sense you conduct programs and create awareness. So that way the entire society would know what is retinopathy of prematurity, and they wouldn't neglect their children. So why does it happen? Now, why is that? Now, what exactly happened this evening is when I was just coming back from the hospital, I received a call saying that there is a baby, and this baby's retinal condition, premature baby, and this baby's retinal condition is not so good. Okay, so he sends me the WhatsApp message of another treating doctor. So what actually happened to this child is, now this baby was seen in a hospital, and then this baby was advised treatment. Now the parents decided that they would go to another place and get the treatment done, but by then it was too late, and now the baby's retinal condition has worsened, and most likely that the child is going to be blind. No, it just happened yesterday. I mean, it just happened today. I just received a call when I was returning from the hospital. So why is it happening? Now, it is happening because a child might have, the baby's eye looks absolutely normal from outside. Now, if you look at this baby's eye, the baby's eye looks absolutely normal. The baby is fine. The baby's eye is not red. The baby is comfortable. So parents don't realize there is something inside the eye. So there is problem inside the eye. You can see this orange structure that you're seeing here is the retina. So the problem is inside the eye. So that's very unfortunate about this disease. There's absolutely no pain. Usually when a child has got pain and redness, they come running to us, even if it's night or whatever, they are very concerned. But in this condition, they don't realize there's actually a time bomb inside the eye, that the child might lose his eye any time. So that's very unfortunate about the disease, and only thing that we can do to tackle this is to create awareness. So even if we tell, parents don't understand. They think that they don't accept that there is some problem in the eye. So it's a virtual meet here. I'm unable to see the audience. I would have loved to meet all of you. Let me just play some game with you, ask you some questions so I know whom I'm talking to. So I will just come out of the presentation. All you have to do is the participants, please go to this www.menti.com. Just go to Google and just type www.menti.com, and there will be an option where you have to use the code and write this code. You can write this number. It is displayed on the screen here. The code is 3316106. I just want to communicate with someone, so the only person whom I can communicate now is Ashwini. Are you able to go to Google and log into www.menti.com?
Yes, ma'am.
Yeah. Did you write the code? I will just
1 second, ma'am.
I'm not able to.
Students can respond if anybody could do it.
Yeah. Any students around who would want to respond and tell, are you all into www.menti.com? The code is right there. You just have to type 3315106. Okay. Wonderful. So what
it's saying that its presentation is no longer active.
What is it? I'm unable to hear.
Presentation is no longer active.
Okay. Now suddenly the okay, wonderful. Less than 18 years, there are 8%, 14%. Oh, very good. So we have kids also here. So it's wonderful that they are here. And most of them 19 to 30s are all students here. Welcome to this, and thank you for participating in this awareness program. I'm sure you will all create awareness and help prevent this little one. Probably you might be, if not now, many years from now, prevent a child from becoming blind, and that's a big achievement. That's wonderful. So we have students here between 9 to 30 years of age, and yeah, wonderful. Wow, that sounds great, and I'm very glad that there are children here less than 18 years of age. Wonderful, excellent. Okay, so now shall we go to the next question?
Hello, ma'am.
Yes.
Ma'am, can I interrupt for
Yes.
a few minutes?
Yes.
Dr. Bappal sir is online.
Oh yeah, fine. We can. Yeah, I will just humans. Okay, we all feel sad and we are totally unhappy of being blind. So there's wonderful response here. So empathy, retina, darkness. Being scared. Of course, we are all scared of dark. So just imagine, a child has no vision and he doesn't see anything else. Okay, so I'm glad that all of you are very sensitive and you're all here for a good. So let me just, yeah, we can stop playing now, and then let me go back to the presentation. So we know that we do not like darkness. We are sad when we hear about blindness. So this is a very small video where it's a story of a child who is born blind, probably. Yeah. So I think I'm audible now.
Yes, yes, ma'am.
Yeah. So this is actually a very beautiful video about one second. Yeah, about this little boy who's in a village. This boy is either born blind or he's become blind due to retinopathy. We do not know that, but just see how this is quite sad. He's all alone at home.
पता नहीं स्कूल कैसा होता है,
This is like these children.
बच्चे पढ़ते कैसे हैं,
We do
क्या
not
सब
see
बच्चे
them
मेरी तरह
anywhere
होते
because
हैं?
they are confined to four
फिर मैं
walls,
क्यों नहीं स्कूल जाता?
and you don't see them in malls, you don't see them in theaters, you don't see them in parks. So it's of course blind children have a lot of facilities, they do well, but it is not nice to be blind unnecessarily. Oh, somebody has started sharing some presentation. I'll have to start.
Srinivas sir, can you stop presenting, sir?
Please, sir.
Yeah, I will just start presenting. Yeah. So we are all here because we want to see happy children. We want our children to be happy. Happy children would be happy family, and happy family is happy India. So I'm very proud to be an Indian, and we do not want any children to be unhappy. So that means to say that we have to spread awareness about this disease and make sure that none of them become blind due to retinopathy of prematurity. Okay, so you must be wondering what we do as ophthalmologists. Like, how do we see this? You know, they're so tiny. Most of the parents, when they come to us, you know, they tell us, "Oh, this baby is so small. How are you going to examine them? Don't." And you'll not believe these are the wonderful babies. You know, they're just so cooperative, and it's so easy to examine them. They're lovely. So let's see how we examine the little ones. And once we examine the little ones, what do we tell parents? What do we tell them about the disease? And we counsel them what happens if the treatment is delayed, and what is the treatment that is offered. Any child, like how sir said, you know, premature babies, these are babies who are not grown well, they're immature, and they're susceptible to so many conditions. So they're not like normal children. You cannot take them back home. So as soon as these babies are born, baby has to be taken to the neonatal intensive care unit. Okay, now these babies are very tender. I mean, in the sense they are more prone to infection, so they have to be taken care of really, really well. So pediatricians, I should congratulate the pediatrician. They really work hard to save the little ones. And when the child is just 2 weeks of age, you can just imagine it's just born, it's just 2 weeks of age, that's when a pediatrician would refer the baby to ophthalmologist for retinal examination, for the examination of the retina. Just make a note of that. It's retina examination of the retina is just not a simple eye examination. And I told you earlier, like what I told you earlier, retina is a layer which is it's in the inner part of the eyeball. Okay, ಕಣ್ಣಿದು ಒಳಗಿಡುವ ಒಂದು ಫಿಲ್ಮ್. ಸೊ ಅದನ್ನು ನಾವು ರೆಟಿನಾ ಹೇಳಿ ಹೇಳ್ತೇವೆ. ಸೊ ಈ ರೆಟಿನಾದು ಪರೀಕ್ಷೆ ಮಾಡಬೇಕಾಗ್ತದೆ. ಇಟ್ಸ್ ಜಸ್ಟ್ ನಾಟ್ ಸಿಂಪ್ಲಿ ಎಕ್ಸಾಮಿನೇಷನ್ ಆಫ್ ದಿ ಐ, ಇಟ್ ಇಸ್ ದ ಎಕ್ಸಾಮಿನೇಷನ್ ಆಫ್ ದ ರೆಟಿನಾ. So we have to remember that all premature babies should undergo retina examination by 2 to 3 weeks of age. Andre magu chikkadiruvagle by 2 to 3 weeks, they're just tiny, they've just been born 2 to 3 weeks back. That is the age that babies have to be screened. Magu dodadagi matte nodwa? No, not at all. Now we have to catch them young. So what exactly happens is when they are in the NICU, in the neonatal intensive care unit, it's easy for us to go and see them because they are in the neonatal intensive care unit. If a baby is born, so just to repeat, there is a premature baby which is born. Premature makkalannu, we take them to the neonatal intensive care unit. Pediatrician takes care of them, make sure that they are fine, they are taken care of well. When the baby is 2 weeks to 3 weeks of age, that is when an ophthalmologist will go and examine the retina of these babies. A small video which shows you how exactly the retinal examination is done. It's a very, very simple procedure. It doesn't require any expensive instruments, where we put the drops into the eye and then they cry a little bit, but examination is it's quick and it's a painless procedure. And we quickly examine the child. Now, what exactly happens in these premature babies is that they are not grown completely. So similarly, the eye is also not grown completely. Similarly, the retina is also not grown completely. So we have to see them every week, either once a week or once in 2 weeks, till the retina is completely grown, till the retina is fully developed. Okay. Now we have to see repeatedly to see now who is the child who will develop retinopathy of prematurity. Now, if they have developed retinopathy of prematurity, now who is that who requires treatment? Okay. So that is why we have to screen all. Screening for retinopathy of prematurity means all premature babies who are born should undergo eye examination. More than eye, it is retinal examination. Okay, so this is how it's a simple procedure. It hardly takes about 5 minutes, and this is how the screening for retinopathy of prematurity is done. So baby is born, baby is in the NICU, baby is being taken care by the pediatrician, and when the baby is about 2 weeks of age, that's when an eye doctor, an eye specialist will go to the NICU, neonatal intensive care unit, and examine the baby, and will decide like if the baby is very small, then the growth of the retina is not so complete, but if the baby is a little bigger, then the growth of the retina is much more. So it's not that the babies require only one eye examination, they might require multiple times, okay, because we have to see them till the retina is completely developed. Now, once we examine the babies, we counsel the parents, we tell the mother that this is the condition of the eye, and we give them information about this. So this is a small video which will actually tell you what's actually going on inside the eye. I've been telling you about retinopathy of prematurity, but what is that is happening inside the eye is what this video would show. So you can see that premature baby, so the baby is here. So now you can see what's actually happening inside the eye. So yeah, so if I use this laser pointer, yeah, so this is the front part of the eye, and the front part of the eye looks absolutely fine. Now the problem is inside the retina. You can see these red lines, these are the blood vessels. So baby is born early, so these blood vessels in the retina is not grown completely. So if a child is born full term, then the blood vessels are grown completely, but when the child is born much early, too soon, then the vessels are not grown. So just see what happens to this. 1 second. Yeah, so you can just yeah. So the vessels, now in this child, what's happening is you can see there's some amount of change. It shouldn't be like this. You can see that there is some change that has happened in the retina here. So now this child has developed something called as retinopathy of prematurity, and if treatment is not given at this time, then the child is going to be blind. Like what sir said, retinal detachment is what happens. Okay, so this is what is retinopathy of prematurity. We show them videos, we give them information on retinopathy of prematurity, we give them follow-up cards, we give them cards saying that okay, this is when you are supposed to come. So you can see this, the child was seen on 3rd, 10th, 16th, 24th. So we have to see them frequently. So that's when the problem happens. I will tell you what exactly the problem is. So baby is born, baby is in the neonatal intensive care unit, we see them at 2 weeks, we examine them, we talk to the parents, and after we talk to the parents usually ask us, doctor, will my baby be able to see? So we tell them, yes, of course, your baby will be able to see, provided you listen to the doctor's instructions, you follow doctor's instructions seriously. Now this is what is lacking most of the time. Now this is why we have lost babies. We have babies in our city who have become blind due to retinopathy of prematurity because they do not follow doctor's instruction. Now why they don't follow doctor's instruction, I will tell you why they don't follow doctor's instructions. There is a total lack of ignorance and awareness. So that is why these babies are becoming blind unnecessarily. So we do tell them, it's a problem inside the eye. So don't miss follow-up, don't miss their retinal examination. And sometimes they do not come. Now I will just share 2 stories. These are real stories of babies, and this has happened with me. This story, a very sad story of a preterm baby. Now you can see that this baby is born, it's in the NICU, and it's connected to so many monitors. Child is very sick, and child is born at 7 months. The weight of the child is about just 1000 grams, and with a good neonatal care, when the pediatricians have done an excellent job, the baby survives. So what exactly happens here is, now first screening, that is at 2 weeks, we have gone to the intensive care unit and we have examined the baby. We go again to the intensive care unit and we see them, and the retina is not grown completely, so baby requires further examination. Now baby is discharged because the baby is fine, baby is discharged, and baby is discharged. So, and the parents are told, okay, this is about the baby's condition. Parents are told this is a condition of the eye and you have to bring the baby back. A follow-up card is given, everything is given, and unfortunately now this baby did not come back to us. Okay, now this baby did not come back to us because the grandparents in the family the mother was willing to come back, but the grandparent in the family told them that we have had so many children who've been preterm and they are absolutely fine. So the grandmother decides that the examination of the child is not important. Now it is not that she has done this with a bad intention. She is doing it with a good intention only because she doesn't want to take the baby back to the hospital because the baby is too small and there is a risk of infection. So this baby was not brought back. We called them several times. Now, in spite of that, they did not receive our calls. And the baby is brought to us for eye test at 6 months because the baby is not able to see now because the baby is not fixating, and the baby has developed retinopathy of prematurity, and it is an advanced case where probably with surgery also baby may not gain much vision. So baby missed a chance for an excellent vision. So now why this has happened, not because the care is not there, not because they could not afford treatment, it is only because of ignorance and ignorance and ignorance. So it is unfortunate. Now the most, as I told you, the problem is parents think the baby's eye examination can be delayed. No, you cannot delay it. They think that it can be delayed because the baby is small. Let us see the baby later. Examination is, they cry a little bit, so let's do it later. Let them become big. No. And we have, our loved ones, our families and friends and neighbors, relatives who would give us negative advice. Now they are giving advice with a good intention, okay, but they do not know that there's something wrong, that something wrong is going to happen to this child. So that is why creating awareness is very important. So if these family members would have known that there is an eye condition which can cause blindness, they wouldn't have told the parents not to go to the hospital. So if we learn about the conditions, if we are aware, then we can tell others. So that is why awareness is absolutely important. But it's not that most of the parents, they come for follow-up, they listen to a doctor's advice. Like this child who was born, we saw them, and then they were very regular with the follow-up, and the baby required treatment, baby underwent treatment, and you can see that the baby is just 8 weeks, means baby is just 2 months of age, and baby requires treatment. And baby is, what treatment that we offer is retinal laser. We just give injections into the eye, and baby requires treatment by 1 or 2 months. So you can see that if this is delayed, then it is gone. I mean, the child has lost the chance to for an excellent vision. So that's why we have to catch them young, and there is no question of delay in treatment. So 1 to 2 months of age is when they require treatment. So there's no question of, let the child become big, then we will examine the child. No way, we have to do it fast. So these are videos of children who have, 1 second, yeah. Okay, so these are videos of, the video is not playing. 1 second.
No, wait.
So this is a video of this child who was in 2010. 1 year of age. She is doing extremely well. She's about 11 years of age now, and she's doing an excellent job. This is another child who's about 7 years of age. They were all treated for retinopathy of prematurity, and they are doing extremely well. Okay, so treatment is absolutely important, and they do a wonderful job. They do really well. They are just wonderful and intelligent children. So it's not that all preterm babies require treatment. It's out of 100 of them, maybe around 7 of them, 4 to 10 of them might require treatment. But to catch hold of these 4 to 10 babies, we have to see all 100 of them. So ROP screening is very, very important. So now you understand that by creating awareness, now we can prevent babies from becoming blind. So now if we create awareness, the family members, neighbors, friends, relatives, they will know that, okay, now this is not a condition, you have to take the doctor seriously and get the baby's eye examined. So that's the benefit of awareness. So that is why it is important to create awareness among in the society. It's our responsibility to do it. So just to repeat again, first follow-up is first examination is 2 to 3 weeks. So we have to kind of catch them very, very young. So 2 weeks is when we see them. They might require multiple visits. So that's when that demotivates them. Sometimes, doctor, I've come 2 times, I've come 6 times. How many more times should I come? So then I tell them, it's your baby's eyes. If you don't get your baby's eye examined now, and if you don't treat them at the right time, then the baby is going to suffer. So it's just that you have to come for few, maybe about 5 to 6 times, but that's worth it because your baby's vision is absolutely important. And babies require treatment like 1 to 2 months. So when a doctor advises that treatment is required, it has to be given immediately. There's no thinking. You can't tell, okay, let me wait for a week or 2 and then do it. No, the treatment has to be given immediately, because any delay in treatment, then it is blindness. The retinopathy of prematurity would progress, and then the laser treatment will not work. Injections into the eye will not work. The only option that would be left is surgery, and there are very few surgeons in India who would operate on a child with retinopathy of prematurity, and the results are also not so good. So It's better that we detect them early and treat them with lasers or intravitreal injection. So what is our role? So first, ROP screening is done here. So we see them, ROP screening is done here. Baby is discharged, and so you can see baby is discharged, and 1 second. Yeah, so the baby is discharged. So, and then they go back home. So once they go back home, that's when the problem happens. Once they go back home, now you have friends, relatives, and neighbors to give you advice now who are ignorant about this disease, and babies might require multiple times. They might have to come several times to the hospital. So that's a little difficult. So this can be treated. So how do you treat ignorance? Ignorance can be treated by creating awareness, and that's why we are all here. So most important, don't delay baby's eye examination. So this is what you have to tell the parents. You come across anybody, you can just go back to your family members and tell them that, baby's eye examination is absolutely important. Don't delay. Don't think that let the baby grow a little big and then get the eyes examined. No, we can examine children of any age group. It would be just newborn to any children. It's very easy to examine. They don't have to grow big at all, and they're very sweet and they're very cooperative. It's not difficult to examine them at all. Follow doctor's advice and delay in treatment. It's very important. It causes blindness. So never, like what happened today, because of the delay in treatment, the baby was told by the doctor to get the treatment done. But then they decided that, they will go to another doctor. So by them, they went to another doctor and then another doctor and then another doctor. The time was lost. The precious